welcome to the Random Review, and I'm your host, Asero Baga. And today's topic, I'll be talking to Abdurrahman Hussein, the physiotherapist, and we'll be discussing about stroke. Stay tuned. So, first of all, we need to know the meaning of physiotherapy.
Yeah, thank you for having me for this podcast. A physiotherapy is also known as a physical therapy. It's a health care profession that focuses on promoting mobility and function.
Yes.
Second one, enhancing physical strength and flexibility.
All right.
The third one, we do focus on improving balance and coordination. The fourth one, we do focus on reducing pain and inflammation.
All right.
The fifth one, which is last, we do educate patients on proper body mechanics and movement techniques. This is all called about physiotherapy.
Okay, as I already said that today we'll be talking about stroke only. So, can you share your experience and expertise in the field of stroke care?
All right. I have 4 years experience in this field of stroke management, and I have dealing with so many patients all over Malawi, and I have been in so many different districts here in Malawi.
Okay, so you work in hospitals or
No, I was working in the community. I was dealing with the villagers.
okay.
Yeah.
So how did you become interested in stroke care? And what motivates you to continue working in this field?
Yeah, there's so many motivation that made me to do this. Yeah, one of them is a personal experience.
Oh,
Long time ago, when I was around 18 years old, I had my late mother who once struck with a stroke.
so good.
Yeah, at that time I had nothing to do about it, and it really affected me because there's no other way that I could that I could do. That's why I decided to go and study physiotherapy, focuses on the stroke.
So, okay, so you wanted to help others, like not be affected.
Yes. Yeah, I wanted to study this because I want to help many people as long as I can.
Okay.
Yeah.
So, what is stroke and how does it occur?
Yeah, to begin with, stroke stroke occurs when the blood supply to brain it is interrupted or reduced, either due to the blockage or rupture of the blood vessels.
So, you are saying rupture. What is the meaning of rupture exactly?
Okay, rupture is what is the same as block.
Okay,
Yeah,
I understand.
yeah, they are similar to that.
Okay.
Yeah.
There are different types of stroke. Can you just mention them and explain a little bit about them?
Indeed, there are different types of stroke. Yeah, one of them is ischemic stroke. This is a type of stroke which caused by a blockage in a blood vessel, reducing blood flow in the brain.
Yes.
Yeah, the second one is hemorrhagic stroke, which is caused by a rupture in a blood vessel, leading to bleeding in the brain. The third one is a transient ischemic attack. This is a temporary blockage, often called a mind stroke.
Okay, so you are saying it is a temporary blockage. You mean it can be easily cured?
Yes, indeed, it's a mind stroke. If it happens to the patient or the one who has a transient ischemic stroke, he or she must rush to the hospital as soon as it has happened.
Okay, so how can someone know that he or she have that type of stroke?
Yeah, he feel numb. He feel numb throughout his body. In some in some cases, he or she can feel numb at his leg or at his hand. So if he feel those signs, he or she must go to the hospital and should be accessed and seek medication.
Okay.
Yeah.
So what are the common causes and risk factors for stroke?
Yeah, there are so many several factors that causes stroke. Yeah, some of them are sudden numbness or weakness in the face, arm or leg.
Okay.
If you feel a numbness in your face or at your leg, this one on the signs of you have a stroke. Yeah, the second is sudden confusion or trouble in speaking. If I'm feeling trouble in speaking, just know that this could be one of the causes of the stroke or signs of
So
your
you are saying
stroke.
trouble in speaking. You mean someone who is who has a stammer, or you
No,
can just stop
no,
speaking?
they're different between stammer and 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 troubling in speaking.
Okay.
Yeah, a stammer is a natural.
Okay.
Yeah, whilst this this what I'm talking about is not a natural. It just happened.
Okay, just happened that a person was speaking properly, but at the
Yeah.
at the certain time he just stopped
Yeah,
speaking.
yeah,
Okay.
yeah, yeah. And the third symptoms is a sudden trouble seeing in one or both eyes. If you have difficulties in seeing, just know this will be one of the causes, signs and symptoms of you have a stroke. And the fourth one, if you it's sudden severe headache. If you feel a headache, eh, this could be also another symptoms of you have stroke. And the fifth one, sudden trouble in walking, dizziness or loss of balance. If you feel these signs, if you feel these causes, please do seek medication.
All right.
And as you have asked me about risk factors, there are indeed different factors. One of them is high blood pressure, this risk factor. The second one is high cholesterol. Third one is diabetes.
Okay. Diabetes.
Yeah, I mean diabetes. And smoking, obesity. If you are obese, in some other cases, you may end up in a stroke.
Okay. So smoking can also cause stroke?
Yes.
It's my first time to hear about that.
Yes, smoking is one of the factors and causes of the stroke, and the BP as well. And also family history. There are some people who inherit this disease from their family members. Sometimes age, it can also another risk factors.
Okay.
Yeah,
So you mean stroke is commonly affecting those people who are
who
old,
are
like elder people?
yeah, in some cases, it is so.
Okay,
Yeah.
so let's proceed. Can you share any personal anecdote or case study about stroke diagnosis?
Yeah. Long time ago, I think it was in 2021, I had this patient. Uh, of course, I won't mention his name.
Okay,
Yeah, for some privacy
okay,
matter. Yeah, this patient had a stroke more than 2 years.
okay,
Yeah, and I did some physios to her within the 6 months of doing some exercise to her. Oh, she indeed improved, and as I'm talking now, she has improved and she's able to walk and she's able to do her duties on her own.
okay, it's
Yeah,
good.
yeah, and now she's feeling better.
Wow,
Yeah.
that's a good story to hear. What are the current treatment options for stroke and how have they evolved?
Yeah, there are indeed different types of treatment that we do offer.
Now, let's take a break. Stay tuned for more informative discussion on stroke.